If your symptoms feel random, energy crashes, anxiety, cravings, gut issues, there's a good chance they're probably not random at all. Today, we're talking about blood sugar chaos and why stabilizing it often solves problems people have been chasing for years. So let's dive in.
Well, first of all, welcome to the podcast, everybody. I'm very excited about this episode because to date, I've laid the framework of how the Popkin Method approaches any medical issue, including lifestyle modification, diet, exercise, supplements, then going into peptide support, hormone modulation, stem cell and exosome therapy, and then finally management of prescription medications if any of them are needed. And each podcast focused on a specific theme. Episode 1 discussed my treatment principles and how the Popkin Method applies to the way I practice medicine. Episode 2 focused on the GLP-1 medications for weight loss, which is all the rage right now. Episode 3 focused on supplements. Episode 4 discussed lab testing. Episode 5 discussed sleep and stress. Episode 6, we discussed peptides, hormone modulation, and stem cell exosome therapy. And then episodes 7 and 8 were kind of a two-part series. Episode 7 discussed clean eating and nutrition as it relates to gastrointestinal symptoms. And then episode 8 discussed gut health as it relates to gastrointestinal symptoms. And one of the main themes in all of these episodes is insulin resistance and glucose instability, which is causing the epidemic of obesity and diabetes in the United States. In today's episode, I will specifically address insulin resistance and glucose instability and how it relates to common symptoms and the progression from weight gain to obesity to prediabetes and eventually full-blown diabetes in some cases. More importantly, though, I'm going to give the listeners some practical advice on how to correct these issues early on so you can live and feel better and avoid all the pitfalls of our Americanized diet and lifestyle. So having said that, let's dive right in.
Well, I'm so excited. This sounds like such valuable information, Dr. Popkin. When blood sugar is unstable, what symptoms do patients actually feel?
Great. Let's talk about something I see all the time in my patients, and that's unstable blood sugar. And anytime someone hears blood sugar, they immediately think diabetes, and that's certainly not the case. Because when blood sugar is off, it usually doesn't show up as a lab number first, right? We're not diagnosing someone with diabetes right off the bat. It shows up as how you feel. And most people, they don't walk into my office saying, I think I have diabetes or I think my glucose regulation is impaired. They say things like, I'm exhausted by mid-morning or by the afternoon. I get shaky if I don't eat. I feel anxious for no reason. I'm eating clean, but I don't feel good. I feel foggy or like have brain fog. And these are difficult questions for a lot of physicians because it requires investigation. It requires actually listening to your patient and taking these symptoms and trying to find a solution. And unfortunately, in our medical society, everyone's looking for a prescription to fix these problems. And I actually look to not use prescription medications. I try to find ways that the lifestyle, diet, and exercise can correct a lot of these things. And what's interesting is that many of these people are doing everything right on paper, that is. So here's what unstable blood sugar actually feels like in real life and what my patients are experiencing. When blood sugar drops too low or it drops too fast, the brain senses danger, right? Glucose is the primary fuel for the brain. So when glucose goes too low, the brain activates your stress response to protect you, to raise blood sugar. And that's when people feel symptoms like shakiness and lightheadedness, sweating, sudden weakness. Sometimes they just describe it as feeling off or they're not quite themselves. But here's the part that surprises most people. Low blood sugar doesn't feel physical, it feels emotional. Patients often report anxiety and irritability or a sudden sense of feeling overwhelmed. And the reason behind this is that hormones that your brain is secreting to get the blood sugar to elevate is what's causing this. You're releasing all the fight or flight hormones, the epinephrine, norepinephrine, glucagon. You're raising, more importantly, cortisol. And that's what's making all of these symptoms come out in these patients. So patients often, as I mentioned, they report anxiety, irritability, or a sudden sense of being overwhelmed. They may feel panicky, tearful, unusually reactive. It's not a personality flaw, that's physiology. That's because cortisol and adrenaline are being released, like I said, to raise blood sugar and support the brain. And those hormones feel like anxiety because those are your fight or flight stress hormones. Then Then there's the mental side of it. People feel brain fog or trouble concentrating, and this is a very, very common complaint. So what do people do? They reach for coffee, and which overstimulates them again, and it kind of creates this vicious cycle. On the flip side, when blood sugar spikes too high and then it crashes, people often experience intense fatigue, especially after meals. That kind of feeling like I need to lie down after I eat feeling, energy that disappears an hour or two after you eat. And think about how you feel after Thanksgiving. You're tired after a big meal. But imagine this feeling occurring after you have a so-called clean meal. So your sugar goes up, it spikes, it comes down, and then you start to feel these symptoms. And over time, this up and down cycle can look like either poor sleep, affecting your hormones so you can't get rest. It'll wake you up at 2, 3 o'clock in the morning. You're feeling wired but tired, which we talked about in episode 5. You can go back and listen to that. These patients are often relying on caffeine to function, needing snacks just to feel normal. So again, stimulating more of an insulin response, stimulating more of a glucose crash. So really kind of making the symptoms even worse. And what's more important to understand is that these symptoms don't always show up as diabetes or even pre-diabetes on lab tests. So you can have normal fasting glucose and still have very dysregulated blood sugar throughout the day. And that's when the doctor tells you your labs are all normal. So now nobody knows what's going on, but the patients still feel symptoms. So unfortunately, they're left with no answers. And this is where clean eating alone can actually fall short, because if someone is under eating, skipping meals, or eating mostly carbs without enough protein or enough healthy fats, or they're exercising intensely without proper fueling, or they're living in a very high stress state because of their job or their families, their blood sugar can be unstable even on a whole food diet. And this is where I'll focus on correcting your lifestyle, your diet, and your exercise program here in this episode. But important to understand that stress plays a massive role here. Chronic stress will raise your cortisol, which alters how the body handles glucose. So 2 people can eat the same meal. One feels great, the other one crashes. Same food, but different nervous systems. So this is why your symptoms actually matter. Your body is giving you feedback long before labs can wave a red flag to tell us that there's something actually wrong. So if you're someone who feels shaky when you don't eat, or you get hangry, you get crashes after meals, or you feel anxious or foggy for no clear reason, those aren't random complaints that you're having. Those are clues that I can work with and correct in my patients. So they're telling us about your nutrition plan may not be matched to your physiology right now. These symptoms are telling us something, and we're not going to find it on routine lab tests. This is exactly why there's no one-size-fits-all approach to eating clean, and why a truly individualized nutrition program is the foundation of metabolic and gut health. And this is where the Popkin Method comes in to create a meal plan that fits your unique body chemistry.
That is so fascinating. And yeah, these complaints and symptoms we're having, like you said, they're the body trying to tell us that something is off and something is wrong. And then we get the labs back and they look normal. And it's like, how do we resolve the two of those things? So that's so interesting. We hear about blood sugar really only in the context of diabetes. So why do you think that people only think that blood sugar issues apply to diabetes? Is that just the standard, or tell us a little bit more about that?
Well, one of the biggest misconceptions I see both in medicine and in everyday conversations is the idea that blood sugar only matters if you have diabetes. And honestly, it's understandable why people think that. It's our medical society. It's how the patients are being treated in the office by their physicians. If your sugar is normal, you don't have diabetes, they say, okay, everything's fine, but you're still having symptoms. And, most of us are taught that blood sugar is something doctors worry about after a diagnosis of diabetes is made, mostly because nobody intervenes until diabetes is actually diagnosed, which is bad medicine. You can intervene before that, before diabetes is actually even diagnosed. We learn about fasting glucose, hemoglobin A1C, insulin injections, and the message becomes if you're not diabetic, this doesn't apply to you. But diabetes starts long before your sugars start to rise on lab tests. And in particular, your insulin levels go up until they can't increase any longer. And then that's when your glucose levels start to increase. And then you start to get into the diabetic range. And it's this state of hyperinsulinemia or elevated insulin in your body which is when we need to act to lower your weight and prevent this from actually becoming diabetes. But unfortunately, most physicians don't even check for insulin levels. So I have this conversation with my patients, and especially the ones that are overweight, and I tell them that you're a diabetic or you're pre-diabetes, and they go, "Well, my lab tests are normal." And I say, "Well, technically they're not. Your insulin levels are elevated." So right now, the way we diagnose diabetes is with a glucose level over a certain amount. But before that number even changes, your insulin levels are going up. So patients are gaining weight, they're getting insulin resistant, their insulin levels are going up. So technically, they're pre-diabetic at that point, but we just don't label it as such. So I try to tell them when you're gaining weight and your insulin levels are high, you are pre-diabetic, if you want to call it that, if it lessens the blow anymore. But the reason this misconception of sugar only being related to diabetes exists because medicine tends to focus on the end stage problems, right? Not early dysfunction or early intervention. And diabetes is what happens when blood sugar regulation has been struggling, often quietly for years or even decades. So this is the problem that we get when some of the medications that we want to prescribe for patients to lower that insulin level may not be covered by insurance companies because they don't have a diagnosis of diabetes yet. So some of the insurance companies, they want you to wait until the person has diabetes in order to treat them, when you can actually treat them to avoid them from getting diabetes, which is really, the way you should be practicing medicine. You should be preventing something, not waiting till it happens and then treating it at that point. So long before symptoms actually meet the criteria for diabetes, patient's body can already be dealing with blood sugar spikes, crashes, stress hormone surges, all those symptoms that I mentioned earlier. And these don't show up as a diagnosis, but they absolutely show up as symptoms, which is why I listen to my patients to get the answers. I don't just look at lab tests. Pretty novel approach, right? Listen to your patient. They'll kind of tell you what's wrong with them. So another reason why blood sugar gets boxed into this diabetes only category is how we test for it. And most routine labs look at fasting glucose, which in a lot of cases are normal, or hemoglobin A1C, which is normal. A lot of times you'll find the answer more often than not if you just listen to what the patient has to say. So, people are told your labs are fine, even though they're dealing with fatigue and brain fog, anxiety, cravings, poor sleep, feeling shaky even if they don't eat, right? These are symptoms that patients are concerned about, but since we don't have a lab test that'll tell us that there's a problem, we don't address it. That's problematic for patients because everything I just mentioned makes it hard to function throughout the day if you have brain fog or you're feeling anxious all the time. You can refer to episode 4 to learn about the lab testing that I'm talking about, plus other lab tests if you like. So go back to episode 4 for that. These so-called normal lab tests, they create a false sense of security and a false reassurance, and it trains people to ignore their symptoms. And unfortunately, the doctors will ignore their symptoms as well. Patients will continue to have these symptoms. They'll continue to DIY their healthcare and try to fix it with either supplements or changing their diet in ways that may or may not be helpful. So it's important for me to listen to my patients. They'll pretty much tell me what's going on with their bodies, and then I can follow a program or create a program that'll fix it. There's also a cultural piece here, right? Blood sugar is often framed as a weight issue. So if someone isn't overweight, they're told not to worry. But insulin and glucose regulation have just as much to do with stress and sleep and muscle mass, inflammation, which we'll talk about in a future episode, gut health, which we just talked about, and nutrient intake is just as important as with body size. And I see athletes with blood sugar instability and these symptoms that I talked about. I see thin patients that have reactive hypoglycemia or low blood sugar. I see people eating very clean diets who are underfueled and running on cortisol all day, creating this tired but wired syndrome. We talk about that in episode 5. But your body doesn't wait for a diagnosis to react, right? It creates all these hormone shifts that make you feel these horrible symptoms. So if blood sugar is unstable, the body will compensate by releasing stress hormones like cortisol. You've heard cortisol mentioned several times throughout all these episodes. You're going to hear it continuing to be mentioned here. Cortisol affects your mood, your sleep, your digestion, your immune function, even how well you build or maintain muscle. And over time, those compensations become exhausting. This overstimulation, this overproduction of cortisol. And this is where individualized nutrition comes in, because supporting your blood sugar isn't about rigid rules. It's about understanding your body's signals early, long before they turn into something that we can diagnose.
Yeah, and it's like we don't want it to have to get that far. It's like the symptom is the problem. We don't need to see it on a piece of paper. It's how does blood sugar instability amplify gut symptoms or gut problems, which we talked about last time, literally is almost like the epicenter, the heart center of the whole body. It affects everything.
Yeah, so now that we understand that blood sugar regulation isn't just a diabetes issue, I hope I made that very clear, that it's something happening in the background for all of us. And the next question becomes, what does this have to do with our gut? So the answer is a lot more than people realize, as I outlined in episode 8 when we talked about gut health. And one of the first ways unstable blood sugar impacts gut health is through the stress response. Every time blood sugar drops too low or swings too quickly, the body compensates by releasing cortisol, there's that word again, and adrenaline. And those hormones, they're life-saving in the short term because it gets your glucose levels or your sugar levels up so your brain is happy, but they're terrible for digestion. And digestion is a parasympathetic process, as I mentioned in the last podcast. Parasympathetic meaning it's the rest and digest phase as opposed to the fight or flight phase that cortisol induces. So it requires the body, digestion requires the body to feel safe. And when stress hormones are elevated, like cortisol and epinephrine and norepinephrine, blood flow is shunted away from the gut, stomach acid production is decreased, and enzyme release is impaired, and motility can either speed up or slow down. This is the fight or flight response that impairs digestion. So basically, the gut stops working properly, and it takes all of the tension away from the gut to preserve the glucose for the brain. So now you're not digesting properly, and you're getting all of these symptoms. And that's why people with blood sugar instability, they report feeling bloating and reflux and constipation or diarrhea because now food is sitting in the stomach, so they feel bloated. If it sits too long, it starts to ferment and they start to get gas. They reflux contents up into their esophagus. That doesn't feel comfortable. When you slow the gut down too much, you get constipated. If you speed it up too fast, you get diarrhea. These are all symptoms that patients do not want and want an answer for. Another connection is the gut lining itself, which I talked about in the last episode, where permeability changes. And I'll talk about this a little bit more. Repeated blood sugar spikes will increase systemic inflammation and oxidative stress, which we're going to discuss in a future podcast episode when we talk about inflammation. And over time, that inflammatory environment can weaken the intestinal barrier, making the gut more permeable, meaning foods and substances in our food that ordinarily would not get through the gut lining and into our system, they're now getting through. And these are typically toxins or irritants that cause inflammation and lead to systemic inflammation and other problems that we're going to talk about. So again, we discussed this in our last podcast. When that barrier becomes compromised, foods that were once tolerated can sometimes trigger symptoms, and people start reacting to foods they've eaten for years and assume that the food is the problem, when in reality, it's the terrain of the gut that's changed. So now what's happening is they remove that food because they think it's problematic, and now they're narrowing down their diet when in actuality, it's their gut that's the problem. So blood sugar instability also alters the gut microbiome. And what the microbiome is the bacterial makeup of your gut, which changes over time, changes because of chemicals in our food, antibiotics that we take for infections, antibiotics that are in our food sources, which is unfortunate because we have very, very high levels of toxins in our food and antibiotics to help keep the animals healthy. But unfortunately, when we eat the meat that these animals were fed antibiotics in order to produce, then now that antibiotic gets into our system inadvertently. High glucose availability in the gut can favor the growth of more inflammatory microbes, while stress hormones themselves can change bacterial behavior and diversity. So the ecosystem shifts in a way that promotes gas and bloating and discomfort. So that's not comfortable for patients. And then there's the motility issue we discussed in the last episode. When blood sugar crashes, the body prioritizes raising glucose over moving food efficiently through the digestive tract. And that can slow gastric emptying in some people, leading to fullness and nausea, or can speed things up in others, contributing to urgency or loose stools, both of which are not comfortable for patients as well. So here's a pattern I see constantly. Someone cleans up their diet, they remove processed foods, they listen to what I discussed in episode 7, getting rid of the processed inflammatory foods. Maybe even they go low carb, but that doesn't support blood sugar adequately. They end up under eating, then over caffeinating or skipping meals, and their blood sugar becomes unstable, stress hormones stay high, and suddenly their gut symptoms get worse, not better. Now they get frustrated because their symptoms are not improving, and in some cases they're getting worse. So what do? They cut out more foods, then they cut out even more foods, restricting the diet further. until they're eating a very limited diet and still not feeling well. Very frustrating on their part. In essence, what they're doing is inadvertently creating their own elimination diet with all the pitfalls I discussed in previous episodes. We don't want to have a limited diet. We want variety in our diet. So what's actually happening is that blood sugar instability is keeping the nervous system in a fight or flight state by raising cortisol and keeping it elevated. And it's keeping the gut in a fight or flight state as well. And therefore, it cannot heal and it cannot function properly. So this is why gut healing isn't just about taking probiotics or supplements or making food lists. It's about creating metabolic safety. And you can achieve this by having regular meals, adequate protein, enough total calories throughout the day so that you don't get those blood sugar drops, and an approach to eating that tells the body it doesn't need to stay on high alert so it can drop the cortisol, it can drop the epinephrine and norepinephrine and take you out of that fight or flight response. So when blood sugar becomes more stable, stress hormones come down, digestion improves, the gut lining has a chance to repair, motility normalizes, so food goes through at a normal speed, and many people find that their food sensitivities actually decrease, not because the foods have changed, but because their physiology did. Episode 7 discussed the food aspect, and episode 8 discussed the gut function as it relates to gastrointestinal symptoms. So go back and listen to build a strong foundation to help you correct any of those issues you might be having, and you'll understand these concepts better if you listen to those 2 episodes. So this is why a truly individualized nutrition plan really matters a lot here. So 2 people can eat the same gut-friendly diet and have completely different outcomes depending on how that diet affects their blood sugar and their nervous system. So if someone is working on gut health, still struggling with symptoms, blood sugar regulation is one of the first places that I look, because without it, we're asking the gut to heal in an environment that simply isn't supportive because it's in a constant state of stress. So that's what the Popkin Method creates. It creates a reduced stress environment for the person so that their gut can actually do what it's supposed to do, process foods properly.
I love it. That's so interesting. This anxiety, this stress, right, that we're going to get into and having the cortisol and the adrenaline just kind of go haywire. Tell us more about the relationship between blood sugar and anxiety. Which comes first? How does that work?
Yeah. Well, I mean, by this point, you probably hear a common theme emerging, right? Blood sugar regulation touches almost everything, your energy levels, your digestion, your sleep. One of the most misunderstood connections is the relationship between blood sugar and anxiety. And it's important because a lot of people actually get diagnosed with anxiety disorders and get put on medications for anxiety when they don't have an anxiety disorder. They have a gut problem. They have a food problem. They have a blood sugar instability problem. So talk about, missing the diagnosis here, right? Because for many people, what they're calling anxiety isn't purely psychological, it's physiological stress showing up in the nervous system. So here's what's happening. The brain depends on a steady supply of glucose. And when blood sugar drops too low or it drops too quickly, the brain perceives that as a threat. It doesn't wait to ask why. It just activates the stress response immediately. This is a protective mechanism that we have in our body to make sure the brain constantly has a fuel source. So that means adrenaline, cortisol, glucagon, all of these things increase. And these hormones are released to raise the blood sugar and keep your brain functioning. But those hormones feel like anxiety. When you have a lot of epinephrine coursing through your veins, you feel anxious. And whereas the brain is happy because it has fuel, the body isn't happy because it feels anxious. People feel sudden, racing thoughts or a pounding heart, internal shakiness, restlessness, a sense of impending doom. Some patients will describe. It can come out of nowhere. It could be in the mid-morning, late afternoon, the middle of the night. That can be problematic if you're at work or you're trying to sleep, you're dealing with your kids, so forth. So these are not comfortable symptoms. And because the trigger is internal, it's often misinterpreted as an anxiety disorder rather than a metabolic signal related to sugar swings. And as I mentioned, some of these people are started on anti-anxiety medications, which doesn't correct the problem. So what's important to understand is that this type of anxiety is often timing dependent. It shows up when meals are delayed or after high sugar or high carb meals cause that spike and then drop, or during intense exercise without adequate fueling, or during periods of chronic stress and poor sleep. So a lot of times you can, if you do a symptom diary, you can figure out the patterns that are happening here. You can see what the triggers are and you can correct them. And once this pattern repeats, the nervous system becomes sensitized. So the more this happens, the more the nervous system thinks that this is normal, and you get stuck in a loop. And the body starts anticipating these drops in blood sugar, and it keeps stress hormones elevated as a protective strategy to keep the brain happy, but it keeps you wired. And then you get this wired but tired feeling, which we discussed in episode 5. It alters your sleep, and it creates this feedback loop that you get stuck in. So even small fluctuations can feel really intense to some of these people. So the blood sugar spikes play a role as well. That's why these sugary drinks that people are taking, these energy drinks, are really bad for them. Aside from all the caffeine, it has a lot of sugar, which causes these rapid blood sugar changes. So rapid rises in glucose triggers insulin surges, which can overshoot, and then it drops the sugar too low and leads to a crash. And the crash then triggers the same stress response, right? People feel jittery, wired, they suddenly feel exhausted or anxious because their cortisol has been shot through the roof. This is why some people feel anxious after they eat, or why caffeine suddenly becomes intolerable. You're putting caffeine on top of epinephrine and norepinephrine and cortisol, and now it feels like you had 10 cups of coffee when you only had one. It's not the coffee alone, it's coffee layered on top of an unstable blood sugar. So to expand this a little further, there's also a gut-brain component here. Blood sugar instability worsens gut inflammation, gut permeability, and transit time, food through the intestines, which increases immune signaling to the brain. The gut produces many of the neurotransmitters that are involved in mood regulation, including serotonin and GABA. When the gut is not healthy, the brain's neurotransmitters are not healthy. And when digestion is impaired, the gut is inflamed and the signaling pathways become disrupted, and you get these symptoms of anxiety and just not feeling well. So now you have metabolic stress, you have gut stress, you have nervous system stress. They all feed into each other, and none of it feels good. And this is where people get stuck. They try to manage their anxiety by using mindset tools or breathing techniques, or they're told, oh, just reduce your stress. But they don't address the actual physiological driver of this, which is unstable blood sugar. So when blood sugar becomes more stable through adequate fueling, regular meals, sufficient protein, and reducing unnecessary stress, the nervous system often calms in ways that feel surprising to people. This is the key to reversing these symptoms. This is what I teach my patients to do, and it works wonders without resorting to prescribing medications. And certainly not tagging patients as being, having an anxiety disorder and putting them on medications for it when it isn't even anxiety from a psychological standpoint at all. It's from altered blood sugar regulation. So that doesn't mean all anxiety is blood sugar related, but it does mean that for many people, anxiety is being amplified or even driven by metabolic instability from rapid changes in blood sugar levels. And this brings us right back to the heart of the issue. Food isn't just fuel in a calorie sense, it's information to your brain. And when we give the body consistent, appropriate signals, everything from digestion to mood can focus and start to stabilize.
That's so very interesting. But it seems like it really not all comes down to, but the thing that people don't think could be the culprit is just poor eating habits, it seems. And like you say, you keep mentioning the kind of stability and predictability of when you're eating, how much you're eating, and yes, the quality of the food that you're eating too, which is so important. So, why do these restrictive diets sometimes worsen blood sugar? Is it kind of like you've been saying, the consistency is not there? How does that throw things
Yeah,
off?
that's why the Popkin method starts with lifestyle modification, diet, and exercise, right? It doesn't start with prescription medications. It doesn't start with lab testing. It starts with correcting the things that are easily correctable. And after hearing all of this, the connections between blood sugar, gut health, anxiety, stress, sleep, this next piece tends to be a light bulb moment for a lot of people. Why restrictive diets sometimes make blood sugar control worse, not better. So on the surface, restriction sounds logical, right? Eat less, cut out carbs, cut out problematic foods, narrow the food list, keep things clean, so to speak. And for some people, temporarily, that can be helpful. But physiology doesn't respond to rules, it responds to signals. And one of the most common problems with restrictive diets is underfueling. And when total calories drop too low, the body doesn't interpret that as discipline, it interprets it as scarcity. Remember, when the brain doesn't get a consistent flow of glucose, it feels that it's in danger and it creates that stress response. And in a state of perceived scarcity, the body prioritizes survival over regulation. And guess what gets elevated? Cortisol, the stress hormone. So blood sugar becomes more volatile, not more stable from underfueling. When the intake is inconsistent or insufficient, the liver struggles to maintain steady glucose between meals, and that leads to drops in blood sugar, which trigger stress hormones like cortisol and adrenaline. You're going to hear the same common theme here. And those hormones raise blood sugars in the short term, but at the cost of increased anxiety, poor sleep, impaired digestion, and over time, insulin resistance that eventually leads to more weight gain and eventually to diabetes in some patients. So restriction also tends to reduce protein intake. And protein is one of the most powerful stabilizers of blood sugar. Without enough protein, your meals digest faster, glucose rises more sharply, and insulin responses become more exaggerated. And that sets the stage for crashes. So, and reach out to me for a grocery list that prioritizes protein, healthy carbs, and healthy non-inflammatory fats. This will help you get the proper foods at the grocery store and to help you start this process of getting better fuel sources into your body rather than things that cause these glucose elevations and crashes and all the things that we're mentioning here with glucose going up and the cortisol going up and all these different stressors that are making your body create these symptoms that really can be fixed by changing what you're putting in your body. Then there's the carbohydrate restriction, right? People, they think carbs are the problem. So while some people do well with low carb diets, others experience increased blood sugar instability, especially if they're physically active or they're under high stress or they're not replacing carbs with adequate fat and protein. They remove the carbs, but they don't replace them with something. So again, you're in a calorie deficit, you're in a glucose deficit. Brain perceives that as a threat, so cortisol goes up, and everything we mentioned is what keeps occurring. And in those cases, low carbohydrate availability increases cortisol output to maintain your blood sugar, so people feel wired, anxious, shaky, eventually exhausted, and they assume they need more discipline, not more support. They start to restrict their diet even further. And these restrictive diets also disrupt the meal timing. People will skip meals, they'll extend their fasts, or they'll eat very small portions. And it trains the body to expect long gaps without fuel. And for some, their nervous system, that creates chronic stress signaling, and blood sugar becomes reactive rather than resilient. And this is why people do poorly, or some people do poorly on intermittent fasting diets, while others will thrive on them. That's why it's important to individualize this. See how your body responds to lowering carbohydrates. Some people do great with it. Some people do very poorly with it. And we can't ignore the gut here, right? We talked about this in the previous episode. Restriction of the diet reduces dietary diversity, which impacts your microbiome. And a less diverse microbiome is associated with impaired glucose regulation and increased inflammation. We're going to talk about that in a future podcast episode. So even though someone is eating clean, so to speak, their gut environment may be becoming less supportive of metabolic health. And over time, this combination of underfueling, elevated stress hormones, reduced gut resilience, it creates a paradox. The stricter the diet becomes, the harder the blood sugar is to regulate. And understanding the goal isn't restriction, it's stability. You need adequate calories, consistent meals, enough protein, a level of carbohydrate that matches your stress and activity level, and a diet that supports the gut rather than narrowing it unnecessarily. And that's what the Popkin method creates.
Got to make sure the stability is there, Dr. Popkin. That's the key. Okay, so we talked a lot about our waking hours and what we need to do during the daytime, but how does sleep disruption at night feed into blood sugar chaos?
Yeah, so we talked about sleep in episode 5, and a lot of the problems that occur with your sleep have started during the day, and a lot of the problems that occur with poor sleep extend into the next days. It's super important. So by now, you probably see how all of these systems are talking to each other, right? Blood sugar affects anxiety, anxiety affects digestion, restriction creates stress hormones, and sleep sits right in the middle of all of it. And because sleep disruption doesn't just make you tired, it actively creates blood sugar chaos. And here's why. During healthy deep sleep, the body recalibrates. Cortisol follows a normal rhythm. It decreases overnight. Insulin sensitivity improves. The liver carefully releases glucose to keep the brain fueled overnight. So sleep is when the system resets. So when sleep is shortened or fragmented or inconsistent, that reset never happens and it leads over into the next day. So even one poor night of sleep raises cortisol levels the next day. And cortisol's job is to keep blood sugar available for your brain. So it tells the liver to release more glucose and make cells less responsive to insulin. That means higher blood sugar after meals, bigger swings throughout the day, and eventually insulin resistance, which can lead to diabetes eventually. Over time, this creates a pattern where people feel tired but wired. So what do? They need caffeine to function. They crash mid-morning or mid-afternoon. They feel hungrier than usual despite eating the same types of foods. So there's also a direct connection between sleep and nighttime blood sugar. So tell me if this sounds familiar. Many people wake up between 2 and 4 a.m. feeling alert. They wake up for no apparent reason. They feel anxious. They're unable to fall back to sleep. And often it's not because of insomnia, it's a blood sugar drop during the night that triggers cortisol surge and that wakes you up. You feel tired but wired. Go back to episode 5. We talk about all of that. Very frustrating. You wake up in the middle of the night, you can't get back to sleep. So what do? Some people take a sleeping pill. Some people take Tylenol PM or they take Benadryl. And that just worsens the problem. So the brain senses falling glucose and releases stress hormones to raise up the glucose, but these hormones wake you up. So it's very frustrating. People can't get restorative sleep. Everyone knows how they feel the next day when they don't sleep well. So the next day becomes a cycle of fatigue, caffeine, irregular eating, more blood sugar instability, setting up another poor night of sleep. So we have to break this cycle. So what actually helps is restoring rhythm, right? Our body is in a circadian rhythm. It wants to raise cortisol during the day so you can be active, lower cortisol at night so you can sleep. So a consistent awake and sleep cycle is very important. So consistent sleep and wake times, adequate fueling throughout the day so nighttime blood sugars stay stable, reducing late night stress and late night signals that activate your brain, like television, your phone, doing work late at night, exercising late in the evening. Whether it's undereating, overtraining, or overstimulation, it creates this problem. You can correct your sleep, though. Blood sugar regulation often improves automatically. Energy becomes steadier, cravings will soften, anxiety decreases, and digestion improves. So obviously, sleep is vitally important to feeling healthy.
Absolutely. I want to point out you had a cool little Popkin Method cup that you took a sip out of, some cool merch there. What I'm curious, I don't know if you're just listening to this, you can't see the image, but what's in that? Is that just water or what's
No,
going
this
on?
is a really cool, I got some really cool merch for the Popkin Method. And this is it's a cooler cup that I have protein throughout the day. So I'll have a scoop of protein. I mix it with 5 grams of creatine. And I also take it with omega-3 fish oils, probiotic, and magnesium glycinate. During the day, I have frequent feedings, for lack of a better term, of protein to stabilize my blood sugar, to feed my muscles throughout the day, and to avoid that insulin or that glucose spike and that insulin crash. So that's it's important. It's what we're trying to teach people today is you don't want to underfuel. And if you fuel yourself with consistent carbohydrates or healthy carbohydrates, healthy fats, and healthy proteins, you avoid those wild blood sugar fluctuations that cause the symptoms that we're talking about. So that was pretty perceptive of you there. You caught me sipping off the Popkin Method merch there.
Is it like a protein shake that you make? Like what's the flavor?
The big thing here is you want to have about a gram of protein per pound of ideal body weight. So if their ideal body weight, if you're female and your ideal body weight, let's say for argument's sake is 125, that's what you want your body to be. And if you happen to be more than that and you want to lose weight, your target body weight is 125 pounds. You want 1 gram of protein per pound of ideal body weight. So you want to try to get 125 grams of protein throughout the day. Pretty difficult doing that with food sources, right? Eggs and chicken and steak and meal preps and so forth. So what I tell my patients to do is to get a good quality protein shake source. I like Thorne Pharmaceuticals. I like Transparent Labs. These are clean sources of protein. I like chocolate. So a scoop of protein, about 25, 30 grams. I mix it with, I have 10 grams of creatine throughout the day. So usually 5 grams in the morning and 5 grams later in the day or after a workout. And it's super important to have clean sources of protein, especially if they're protein shakes, because a lot of these protein shakes that are made by certain companies, they have contaminants in them. There have been reports that there's lead and cadmium and mercury in some of these protein shakes. Some of them put other binders and fillers in there that they're not healthy for you. They cause inflammation. So I put patients on regular protein throughout the day, and usually a protein shake in the morning, a protein shake after they train, and then healthy protein throughout the day, either eggs, chicken, steak, and other vegetable sources of protein as well. So it's important to maintain your protein levels. And when you have enough protein in your body, you tend to stay away from a lot of the carbohydrates that cause these blood sugar spikes that we're talking about. I try to tell people to stay away from those caffeinated. I won't mention the coffee company, but when you go to the coffee shop and you get these mocha cappuccinos that have all these sugary flavors in them, it just spikes your blood sugar. So now you have spiked blood sugar and caffeine, which when it wears off, you get that crash. And then what do? You reach for either more comfort food or more caffeine or more sugary foods. And then you just create this vicious cycle. So healthy protein throughout the day, healthy, stable carbohydrates, and healthy fats. And most people don't really know the difference between what is healthy and what isn't. So reach out to me at the Popkin Method. I'll send you a healthy grocery list of what those things actually are so you can have them in your house.
Love it. Love it. Yes, I'm excited to see this grocery list. So I'll hit you up after this episode so you can send it to me too. Great. What are some common signs that maybe someone realizes that they have a blood sugar issue? They're very self-aware. They're noticing the symptoms in their body and the spikes and the dips. What are the signs that someone is like chasing the wrong solution or kind of on the hamster wheel, like, ticking off all the wrong boxes to try to improve it, despite their best efforts?
Yeah, I think unfortunately most people are chasing the wrong solution because of our Americanized diet with, all the things we have available to us and all of the deceptive marketing that goes on. People think that, taking a Red Bull, throughout the day is going to be helpful for you. And then drinking coffee throughout the day, we're kind of conditioned with, drinking coffee, drinking caffeine, stimulants, all these energy drinks and so forth. And then they wind up chasing their symptoms around. So some common signs that people are chasing this in the wrong fashion, we'll get into that. After walking through all of these layers, right, we talked about blood sugar, stress, gut health, and sleep. This is where I often need to gently pause patients and ask a very different question, right? Are we solving the problem or are we just chasing it, right? Because here are some really common signs that someone is working hard to improve their blood sugar stability, but it's going in the wrong direction. One of the biggest red flags I see is supplement overload. Now, supplements can absolutely be helpful, and everyone knows I'm a huge proponent of taking appropriate supplements. But when someone is taking a long list of blood sugar blends, adaptogens, berberine, magnesium, chromium, herbal teas, yet they still feel shaky and anxious and exhausted or reactive, that's usually not a deficiency problem that a supplement can fix. It's a signaling problem. And very important to understand that no supplement can override underfueling, poor sleep, chronic stress, or even an unstable nervous system. If there's a supplement out there that can do that, patent it, sell it, you'll be a multi-billionaire. That's why lifestyle modification, diet, and exercise precedes everything, including supplements in the Popkin method. In fact, piling on supplements can sometimes add more physiological stress, especially if they're being used to compensate for skipped meals or restrictive eating. Again, I love supplements, but, appropriate supplements. And with Amazon, I make the joke, people think about getting something on Amazon and next thing you know, someone's knocking on the door, they're delivering it, right? And we talked about, I believe in episode 3, we talked about supplements and some of the pitfalls. Listen to that episode. You got to be very careful with the supplements you take, where you get them from, the sources, to make sure that they're legitimate sources and good quality supplements. So another sign that people are chasing the wrong solution is constant plan hopping, right? You see this all the time. This is the person who's tried low carb and keto, intermittent fasting, carnivore, plant-based diets, glucose tracking protocols, sometimes all within the same year. And each plan works briefly, but then it stops working. And then the response is to do what? No, switch to something else. If keto didn't work, well, let's try, intermittent fasting. If that doesn't work, let's go to the carnivore diet. Really without understanding how to link your symptoms to what diet is causing the problems. What's usually happening isn't that the plans are failing, it's that the body is exhausted from repeated shifts, restriction cycles, and stress signaling. So blood sugar regulation thrives on consistency, not novelty. So these diets just add more chaos to your blood sugar regulation. And every time the plan changes, the nervous system has to adapt again. And for a system that is already under strain, that constant adaptation can worsen instability of your blood sugars. Another subtle but important sign is when someone is chasing numbers instead of listening to symptoms. I see this all the time. Patients may have normal labs or acceptable glucose readings, but they don't feel well, or they're overly focused on avoiding spikes while ignoring fatigue, anxiety, poor sleep, or other digestive issues. So it's important to understand that blood sugar doesn't exist in isolation. If the body feels unsafe, metabolically or neurologically, it'll compensate regardless of what the data says. And finally, one of the clearest signs is that someone is chasing the wrong solution is when the approach keeps getting more complicated, but the body feels worse. So true stabilization usually feels simpler, not stricter, right? KISS, keep it simple, stupid, right? More grounded, not more anxious, more flexible, not more fragile. So when blood sugar is supported appropriately, people often say things like, I'm not having as many food cravings as I usually do throughout the day, or I feel less hungry, or I can go longer without panicking if I miss a meal. And, that's how you know you're moving in the right direction, when you're making changes and you're actually feeling better with your symptoms, not necessarily tracking numbers or lab data. So if someone is overwhelmed by supplements, afraid of food, or constantly switching plans, it's not a failure. It's a sign that the strategy needs to shift from control over to support, because blood sugar stability isn't built by chasing the perfect solution. It's built by creating safety, consistency, and trust in the body again.
Yes. And like you just said, we can do way too much and to try to solve it. And that's actually doubling down on the problem. So stabilizing, coming up with a simple, effective, and consistent plan to get, our body back in the right gear. What does that look like? What does, stabilizing the blood sugar look like day to day?
Sure. So, having said all of this, what do you do next, right? We want to give the listeners some practical tools on how to actually fix this. And if you recognize yourself in any of these patterns, supplement overload, food fear, constant plan hopping, I want to pause here and say this clearly. Nothing has gone permanently wrong. We can fix this. Those are not failures. They're signals that something is going wrong.
I think people feel like they're like broken at some point, or perhaps maybe they've never experienced it before. And they're like, this is not a death sentence, but something that's very kind of final instead of able to be at reverse, but kind of healed and gone back to where they were. So say it louder and again for the people in the back.
Your gut isn't permanently broken. These symptoms are simply a sign that something is wrong. And if they continue, it just means you haven't found the right solution. And, DIYing your healthcare, do it yourself, trying to come up with the solution without proper information is a big problem. And that's why, we have this podcast, is to teach people how to look at things objectively and make proper changes. And then, we've already had people reaching out to me through the podcast website and setting up appointments and getting this information and having me help them to create these programs. And the information alone should help you to be able to do it. But if you need more help, certainly reach out to me and I'm happy to get involved. So, these symptoms, as you mentioned, you're not permanently broken. These symptoms are a sign that your body is asking for support, not more control. So what do you do next, right? This is really what we want to help the listeners to understand. The first step is to simplify, not optimize. So before adding anything new, ask a more foundational question. Is my body getting consistent fuel, right? That means regular meals, enough total calories throughout the day so that your brain is supported with enough glucose to keep it happy so it doesn't activate that stress response. and enough protein to keep blood sugar steady between meals and to help maintain muscle mass. So, for many people, just eating consistently without long gaps or constant restriction, or eating more protein and less complex carbs starts to calm the system down. And again, I'll provide people with the shopping list on what foods to avoid and what foods to eat, from protein to carbs to fats. The next step is to focus on predictability. Blood sugar regulation thrives on rhythm. Similar meal timing throughout the day, similar sleep and wake times, a nervous system that doesn't have to guess when the next stressor or the next fuel source is coming. This isn't about perfection, it's about reducing the surprise. Then shift your attention from numbers over to signals. Listen to your body. Instead of asking, did this spike my blood sugar? Ask, how do I feel 2 or 3 hours later? Is your energy steadier? Is your mood calmer? Is your digestion improving? Those responses tell us far more about regulation than any single data point can. Another key step is to reduce your fear around food. That doesn't mean eating anything you want or ignoring the symptoms. It means approaching meals from a place of nourishment rather than vigilance. Eating slowly, including protein in your diet, allowing carbohydrates that support your activity level and stress load. You don't want sugary carbohydrates. You want more vegetable type carbohydrates. You want to stay away from these white bread and white rice and these complex carbs that stimulate insulin production and cause these glucose drops. Remembering that the nervous system plays just as big a role in blood sugar as the food on your plate does. And finally, give your body time, right? Give your body some grace. Blood sugar stability isn't rebuilt in a week, especially if there's been chronic stress, poor sleep, restrictive diets, gut dysfunction. But when the inputs become consistent and supportive, the body almost always responds. So in a lot of cases, people have spent years damaging their bodies by trying to fix it and just doing the wrong thing. Give yourself time to heal. First thing my patients notice isn't better labs. It's that they feel calmer, they feel less reactive, they feel more resilient, even before laboratory data changes in the positive direction. And that's the goal, because when blood sugar stabilizes, everything else we've talked about, digestion, anxiety, sleep, energy, has the foundation it needs to improve. So instead of chasing the next solution, start by creating safety and consistency. That's where real healing begins. Again, this is where reaching out to a provider that has experience in creating an individualized nutrition program is essential. Again, feel free to reach out to me at the Popkin Method website if you need assistance with creating a supportive meal plan, or if you need specific grocery lists to help create your meal plan.
Awesome. How does the Popkin method prioritize stabilization before restriction? You keep on using this word support, which I love. So let's talk about this stabilizing support.
Yeah, that's important to understand. After walking through what blood sugar stability actually looks like day to day, this is where I want to zoom out and explain how the Popkin method approaches this differently from most nutrition plans that people are seeing out in social media and so forth. Have regular meals, have adequate calories, have enough protein to support blood sugar and muscle maintenance, have predictable timing with your meals so your body knows it's going to get calories in a certain timing pattern. The goal isn't optimization, it's reassurance. We want the body to trust that fuel is coming consistently and that it doesn't need to rely on stress hormones to survive.
That almost sounds like a really healthy relationship, you know?
Yeah, it's simple. It's, a lot of these things, it's common sense, right? And yeah, you can certainly apply that to relationships as well, which again have, they have their own stressors involved with them. So this is no different. And, once the system begins to calm, the next step is to reduce blood sugar reactivity through proper diet choices, right? So now we've calmed the system down, body is not on high alert. So now we can make some proper diet choices. And this is where the strategy comes in, but it's still individualized, right? Everyone's going to be different. We use protein first meals. So you're prioritizing protein. You have appropriate carbohydrates in your diet. That's where the grocery list, if you need, I'm happy to send it to you, will come in. And fats that slow digestion. We pay attention to how meals feel 2 or 3 hours later, not just what they look like on paper. So you eat something, see how it makes you feel a couple of hours later. If you feel anxious or you feel tired or you feel like you're crashing, then something is off in that meal and you can go back and look at it and see. And in a lot of cases, it's pretty easy to find out. There's a lot of hidden sugars and a lot of hidden ingredients in foods that if you just Well, they're not hidden, they're on the labels, but people aren't looking at them. Or the labels are deceptive because they might say, low fat. Well, low fat doesn't mean what is the sugar content, right? If you're taking fat out of something, you tend to replace it with something else. Otherwise, people wouldn't buy it. So, deceptive labeling, you got to be very careful. Learn how to read labels, learn what you're putting into your body, and go back to what we talked about in episode 7, right? You want to put things in your body that have simple ingredients, that are whole foods. You don't want a long list of ingredients in your foods because that typically is where you start to get the problem. That's where you see the colors and the dyes and the high fructose corn syrup and things that are really bad for you. So learn how to read the labels. Instead of cutting foods preemptively, we focus on building meals that create steadier energy, clearer thinking, and fewer crashes. The blood sugar responses become smoother, not because the food was taken away, but because the meals are structured to support your unique physiology. And that's based on how you feel a couple of hours after you eat. So only after blood sugar becomes more resilient do we move to the third step, and that's safely expanding your food tolerance. And this part is critical and often missed. Most people come in with a long list of foods they avoid because of symptoms they've had in the past, and they think it's related to that particular food. And in some cases it is, in some cases it's not. But when blood sugar is stabilized and the nervous system is calmer, the gut environment changes and can accept those foods better. So inflammation decreases, motility improves, and digestive capacity increases. So foods that once triggered symptoms can often be reintroduced carefully and strategically, not all at once, because we don't know if we reintroduce these foods and you have a problem, we don't know which food it's caused by. And we don't do it blindly. We look at symptoms. We do this with intention and observation to make sure that when we put foods back into the system that were once problematic, we want to make sure that they're not causing the same symptoms. Again, it's common sense, just being very systematic about how we reintroduce these foods. The opposite of restriction is expansion. That's what we're trying to do. We're trying to make your diet diverse for all the reasons I just mentioned earlier in the podcast episode. And it's why the Popkin method doesn't chase perfection or rigid rules. It builds a foundation first, and then it increases flexibility and resilience over time. And again, when blood sugar is stable, the body becomes more adaptable, anxiety decreases, digestion improves, food becomes less stressful and more nourishing. And that's the difference between a plan that temporarily manages symptoms and one that actually restores metabolic and gut health long term. This is what the Popkin method does.
Love it. Those are such great tips to understand how that can start working the right way. Now, what is one first step or a small change that our listeners can try this week to improve stability?
So let me bring it all together. We talked about a lot of stuff here. We unpacked a lot of material, and the key concepts are the same. We want to stabilize your blood sugar. So as we wrap up today's episode, let's take a step back and see how this all fits together. The Popkin method is really built around one central idea, and that's to stabilize first and then expand. So we start by calming the system, like I said, making sure the body feels safe with regular fueling, adequate protein, and predictable meal timing. From there, we reduce blood sugar reactivity by making meals work for your physiology, not against it. That's why we ask, how do you feel 2 or 3 hours after a meal? So you can judge whether it's working for you or not. And finally, once the system is calmer and more resilient, we expand food tolerance safety, reintroducing foods in a way that the gut and the nervous system can handle. Everything we talked about today, anxiety, gut symptoms, sleep disruption, restrictive diets, it ties back to blood sugar. And when blood sugar is stable, the nervous system relaxes, digestion improves, energy becomes steadier, and food stops feeling like a stressor. And here's the good news. You don't need a complete overhaul to get started. Small, consistent steps are often more powerful than radical changes. So here's one simple change you can try this week to support blood sugar stability. Choose one anchor meal, whether it's breakfast or lunch or dinner, and make it a predictable, protein-forward meal with less complex carbs and more healthy fats. Something you can rely on every day. No perfection, no overthinking, just a meal that gives your body fuel it can trust. By giving your body this one stable signal, you start to calm the system, reduce unnecessary stress responses, and lay the groundwork for steadier energy and improved digestion. Remember, blood sugar stability isn't built overnight. It's built day by day, meal by meal, habit by habit. But when you give your body consistency, safety and nourishment first. Everything else, like mental clarity, gut comfort, energy, and resilience, follows naturally. Start small, anchor one meal, and notice the difference this week. That's the first step towards real stability and the step towards trusting your body again. The final takeaway is this. Blood sugar stability is the foundation for energy, digestion, mood, restorative sleep, and overall health. It's not just about avoiding diabetes. The Popkin Method focuses on stabilizing your system first, calming stress responses with predictable protein-forward meals, reducing blood sugar spikes with smart meal choices, and then safely expanding food tolerance. Instead of chasing restriction, fear, or perfection, start with one small, consistent change this week, like anchoring a single protein-rich meal at a predictable time, and watch how your energy, digestion, and focus begin to improve. Small, steady steps create real, lasting balance. If you'd like additional support, you can message me through the Popkin Method website or any of my social media platforms, and I'll send you a patient-friendly Popkin Method grocery shopping guide so you know what foods to improve your blood sugar stability, which foods to avoid, and you can put together a program for yourself. It's written in clear, supportive language and aligns with my physician-led approach to clean eating, gut health restoration, fat loss, and lean muscle support, so you can start making changes that help your body heal rather than feel more restricted.
Love it. So, in closing, before we start blaming food or hormones or even your own willpower, check your blood sugar stability. When our system calms, symptoms often fade, which is what we're looking for. And that is the Popkin method. Stabilize first, optimize second. So, if you're ready to explore these therapies in the right way, visit thepopkinmethod.com to learn more and schedule an online discovery call or an in-person visit with Dr. Popkin today. This is the Popkin Method, and we will see you next time.
See you next time.